Hello, everyone, and welcome to this special edition on the Endometriosis Awareness Month of March. I'm Trish Barasa, and I advocate for those of us who live and journey with chronic conditions, and endometriosis being one of them. And also, I being an endometriosis survivor, this is a special edition for us to commemorate, advocate, and support and build a community around those of us who journey with endometriosis. Endometriosis has gotten a lot of attention in the media, particularly in respect to understanding what the condition is about. And so far, there is no agreed literature or, let's say, evidence towards what it is. But what so far is turning out to be is that it's a systemic inflammatory disease where endometrial like tissue appears outside the uterine cavity. And remember, it's systemic and it's inflammatory. Endometriosis Awareness Month came about to build advocacy and foster support and even build community, which is really one of the themes of this year's Endometriosis Awareness Month of March. March doesn't have much activity around it, and it has gotten consensus and a lot of support to being this month which focuses on endometriosis around the globe. We seek for advocating and taking agency around understanding this disease, which is a taboo as it is, because first of all, it's about menstrual issues, and it's sort of a female issue, and no one wants to discuss it. There's a lot of taboo around it, but so far we have seen a lot of support that has been built around it, and we've also recently seen a production that was done by Hillary Clinton, who is also a survivor of endometriosis. And so we're just seeking to build advocacy and create awareness around the disease and ask for more support, funding, research into the condition so that there is more done around it, including even seeking to find treatment and a cure to this incurable illness. Now, one of the common symptoms of endometriosis is pain and inflammation that surround the monthly periods. And strangely, it lasts longer than the cycle because the lesions build their own estrogen hormone. And there's no place for them to shed, and they're happening outside the uterine cavity. And it's something which eventually needs to be diagnosed by surgery. So when the lesions are finally found and excised, or there's ablation, you tend to find that they are endometrial-like lesions and they cause a lot of pain. Actually, patients who journey with chronic conditions will always complain of a lot of pain that outlasts a cycle. Endometriosis treatment options are very limited because it's not a curable condition. And just as it is surgically diagnosed, whatever lesions that are found will be surgically removed. And they're found literally in any organ in the body, mostly around the bowel and the lower abdomen. There's even those who've been found with endometrial lesions in the brain. At the navel, I think there was a feature once in one of our local media houses where there was a lady who has to put a pad on her navel because she has endometrial lesions outside her body. And there is not much options, and it's lifelong. You keep managing it, you keep removing the lesions, you keep managing the pain that comes with it. And some of the misconceptions that are being peddled around, even by our own doctors, that should you maybe stop the ovulation process and starve off the hormone, that this will end. No, it doesn't, because these lesions build their own hormones. These lesions live their own life, and they're inflammatory, and it comes with a lot of pain, and it causes havoc in women's lives. It literally just changes a woman's life. I'm happy to report that there have been research efforts in the recent past on a drug that is said to be able to cure endometriosis. We're yet to see how far that will go because the drug is even yet to go into the clinical trials, and this might take 7 years or longer. But so far, the options that are out here only serve to just continue the misconception that there is a cure for endometriosis, but there's no cure for endometriosis. You'll manage the symptoms as they come. So it's purely symptomatically managed. And the research that we are seeing so far, hopefully that gets us somewhere. And with more funding towards endometriosis and towards women-related challenges, maybe we will eventually see a cure to endometriosis. Endometriosis impacts a woman's entire life. I don't think there's any aspect of a woman that's not impacted because it even causes fertility. It affects you socially. It isolates you. It alienates you. The pain is debilitating. It's pain that has mostly left most women unable to go about day-to-day activities as they are supposed to. Some of them even fall off work. And what we are seeing is lived experiences of women who literally are not able to go through a normal day-to-day life because of endometriosis, because of the pain, because of the bloating, because of the nerve issues, because of the disability that arises from the same, and many other issues. And this can impact not just socially on a woman's life, but mentally, financially, because every other time you're going to hospital and not finding help, support, is another day when you're going back into your home without any hope and just full of despair. From a policy level, I would say, first of all, funding towards endometriosis is needed. I am yet to see much of that from our own government, although governments like the UK and out there in the US are doing a lot more towards this funding. We've heard about a 13-year-old who's suffering from endometriosis. And this to me is really just shocking. And I hope that, because for me, it's taken me 2 surgeries to, first of all, be able to manage my own endometriosis, and a lot of pain meds, including long-term use of opioids, days off work, and really a negative lived experience. And so I hope that the government can look at this from the intersectionalism of women, the role they play, and invest in endometriosis. Secondly, if the medical practitioners can also get informed, because when a woman comes to you and tells you they have endometriosis, and you first of all start doubting their sanity, you think they're making up the pain, you're part of the problem. So be part of the solution. Let's look into ways of helping these women. It takes longer than even 10 years sometimes to diagnose a woman with endometriosis. And this is after a really stressful period where they have probably fallen behind their peers in terms of life. Thirdly, for patients, take agency for yourself. Don't let anyone call you mad for having painful periods. Painful periods are not normal. Long, heavy periods are not normal. And it's about time as a society we called a spade when it comes to endometriosis and accept that painful, long, severe periods are not normal, and that woman needs all of our help. Let's build support, let's foster help, let's build a community around everyone who's living with and affected by endometriosis. Just to point out some of the myths and misconceptions that people need to be aware of is, like I said, first of all, severe painful periods are not normal. Periods can be a bit of a discomfort, but they are not supposed to be severe and painful. Secondly, very lengthy, long, heavy periods are not normal. Thirdly, telling a woman that removing her uterus will stop endometriosis is not true. It may address other issues like adenomyosis. Fourthly, telling women that giving birth will address endometriosis is not true. It's a myth. We actually have a 13-year-old who has endometriosis. And for some of us, I have had children and I still journey with endometriosis. Telling women that endometriosis will get better after 30, we are well into our 40s and we're still having surgery. So all these misconceptions, and some of them are sadly being peddled by people who we trust to take care of our health, should really be stopped. Let's educate ourselves. Let's know what endometriosis is. It's a systemic inflammatory disease characterized by endometrial-like lesions outside of the uterine cavity. It could be in any organ. So I'd like to thank you so much for joining us for this special edition, and I hope that we continue to raise awareness, to educate each other, and also just to build a community around those of us who are affected by chronic conditions, and for this particular month, endometriosis. I hope to see you again, and thank you for your support. I'm Trish Barasa. Good to see you. Bye-bye.